Hello and welcome to another episode of the Your Story, Our Fight podcast from Lupus LA. And thanks to our sponsors over at GSK. Today, we're going to have a little bit of a different conversation. I'm going to introduce you to my guest, Andrea Gershwin. And Andrea has, I think, a really helpful and inspirational story about her early diagnosis. And Andrea, you were diagnosed 25 years ago. So I think hopefully things have improved since your diagnosis, but I think your story really sheds some light on what a lot of people struggle with. So welcome to the podcast. How are you?
I'm great. Thanks, Adam. Good to be here.
Excellent. So we were talking beforehand, and I know, so you were diagnosed 25 years ago.
Yes.
But you really, well, I'll let you tell it, but you really have an interesting sort of path toward getting your diagnosis. So why don't you sort of walk us through it a little bit?
Yeah, it was a little, well, between 25 years ago. I was living in New York. I'm in Los Angeles now. And I just didn't feel well. And I went to my internist and he said, maybe you have the flu. And of course, I didn't get over it like I would the flu. I had fevers and a butterfly rash and some joint pain. And I went back to my internist who said, can't find anything wrong. My internist, yes, he did take blood work and it came out just fine. So I went to another doctor. Then I went to an immunologist who said, can't find anything, but you might have in the future an autoimmune disease. I wasn't sure what that meant in the future since I wasn't feeling well that day. But so I would probably in New York went to 6 doctors totally who told me there was nothing wrong.
What kept you pursuing it? I mean, obviously your symptoms kept pursuing it, but I think that takes a lot of mental fortitude to say, okay, all these doctors are wrong, essentially.
Yeah, I mean, I did. But on top of the symptoms, I started researching and I started reading. And I did come up with, I think I have lupus with all my symptoms, putting it together with my reading, research. And I did say to 1 or 2 doctors, I think it might be lupus. And they said, no, it's not, because the blood work doesn't show it. And at the time, there were, I think, 11 criteria I had to meet, and I didn't. And then I went to LA. I mean, I moved to LA and I started the whole process again, going to doctors. Until I finally was referred to a rheumatologist who had an excellent reputation. And he did a whole bunch of blood work. And when I came back, he said, well, you have lupus, but the good news is you're going to die of old age. And as strange as it may sound, I was so relieved. I was almost happy. Because the struggle to get the diagnosis was very, very hard. I mean, it was hard for me, but it was also hard with my family. When I say hard, I had a lot of difficulty getting people in my family to believe me. They thought it was all in my head, and I just didn't get enough support. On some level, it was a journey I really took myself, even though I have basically a very good support system. But going through this, it wasn't there.
Yeah, I mean, I think there's a stigma associated with you look good. Your symptoms could be all in your head, that kind of thing. You also are going through, I'm assuming you're training, you're a psychiatric social worker. So at the same time, everybody is telling you it's in your head and all these doctors are saying you don't have what you think you have. How are you sort of relating what you're learning, in your training and your work to what these medical doctors are telling you?
Right. I didn't really ever doubt that there was something medical going on. I knew it wasn't in all in my head, but I did have to question, well, was I depressed? I've never been had any psychosomatic, tendencies. So I didn't really question myself, although there were times I thought, well, could this be depression? Because I was going through a lot of changes in my life as far as, one job to another and thinking of moving to Los Angeles. So there were a lot of changes, but I never really questioned if there was something wrong. It's really hard as a mental health provider or therapist to, you can't think, well, I know it all, therefore I can't get depressed or I can't get anxious. But that was minimal. I didn't really question myself. I think all in all, what I went through helped me, in my work. It just made me then that much more compassionate or empathetic.
So if you had a client now or a patient that was sort of going through a similar issue, what's your sort of advice to people who that they have that nagging voice in the back of their head that's saying there is something wrong and nobody's seeing me and nobody's hearing me? What do you recommend other than being persistent?
I would say be persistent, and I think you have to really trust yourself, because with lupus especially, and perhaps other illnesses, you may not get a diagnosis right away, but it will come. It will come, and don't give up, and do your research. You can research yourself, and support groups are wonderful. Therapy, of course, if you can, and there's all kinds of therapy. There's free, no cost, or online, but that's really important. But the more support you can get, the better.
I think I also want to illustrate how difficult this got, because I know you have a story about a pulmonologist that you went to see, and I'll let you share. It's we won't name names, but it is a shocking story. So I'll let you tell that one.
It's a doctor in LA who was my primary care physician, although he was a pulmonologist, although I didn't really have lung issues associated with the lupus. And I probably went to him three times. And the third time, I repeated that I really think I have lupus, and in the examining room. And he said, "You don't have lupus." I said, "I've done a lot of research and I have these symptoms." And he opened the door to the examining room and he said, "You don't have lupus, get out." And he opened the door so I would leave. And I was in shock. I mean, he could have said, "You don't have lupus," but to throw me out of his office was, unbelievable. And it was only a few weeks later that I did see this rheumatologist who gave me the diagnosis. And I wound up, I think, writing the other doctor a letter, which he probably either didn't read or tore up. But that is,
well, maybe he's listening.
Story.
Maybe he's listening to this.
I hope so.
He's learned some lessons, because
I hope so. I mean, I didn't know that even existed, that kind of behavior. But
but I think that's it illustrates how resilient you had to be and how persistent you had to be. So I really give you a lot of credit. I think that's really powerful. And I think it's inspirational to the people who listen to this podcast, because I know a lot of them either have struggled with their diagnosis story, or are listening and saying, you know what, that rings true for me too. And so I appreciate you sharing that. We're going to take a quick break. We're going to get some messages from Lupus LA, and we're going to come back and we're going to talk family, because I think that's a really other aspect to your story that people are going to want to hear. So we'll be right back.
Lupus LA provides financial grants for lupus patients in the greater Los Angeles area, up to $500 per calendar year, to cover costs for everything from electric bills, medical copays, medication costs, and more. Please contact our staff for further information.
Welcome back to the Your Story, Our Fight podcast. We're talking to Andrea Gershwin about her journey to get diagnosed with lupus. And I should say too that you're since finding out you had lupus, you've done really, really well. And I think that's also a really great story, finding the right treatment, and 25 years later, you're in great shape. So I think that's really helpful. But I know one of the real challenges you had was not only the physicians, and you mentioned it a little bit before, but you had some real struggles with your family. And I wondered if you could share kind of how bad that got, and how that made you feel, and what you were able to do to resolve it.
It started out again when I was in New York, and very, very close family members did think after a while it was all in my head. And that because maybe, as you said earlier, maybe I didn't look sick and I could still go to work or, spend time with family and friends, that it couldn't be that bad. And it was all in my head. It made me feel awful. Because I was never the kind of person to, feign illness. I didn't get sick that much as a child or a teenager. And one very close family member, I don't want to mention names in case they watch this. And by the way, also, I mentioned it a couple of months ago, and they didn't even remember this. But
right.
They said to me that, or they asked me, do I think I want to die? Is that really what's going on? And it was unbelievable, because I've never been like that. I mean, I've never been that depressed or anxious, or it's absurd to, and I don't know how not feeling well would translate into wanting to die. But it was a few family members who just withdrew their support, and it was actually devastating. It really was. And moving to Los Angeles, it was sort of not being around, these people that much, and I felt much freer to, talk with people, friends in LA, family in LA. And then when I got the diagnosis, I can't say that my family were ecstatic. In other words, saying, right. I'm so glad you got a diagnosis, nor did they express a lot of sadness that I had lupus. So it was a very,
Was there any acknowledgement on their part that, hey, we apologize, we, didn't realize that this was this serious, or anything like that?
No, there wasn't. So it's just something, you decide to just move on, just let go of it, because it wouldn't, and it actually, it didn't matter. What mattered is that, I was correct, and, I was persistent, and once that happened, things got much better all around.
And do you think that, I think what's interesting is the sort of very thin line between illness and mental health diagnosis
Yeah.
or not even diagnosis, but people thinking it's a mental health issue. And we hear that a lot in the lupus community, that they're told you're crazy, you're depressed, you're making it up. And I think, and I'm assuming that, and you're the expert, but I'm assuming that there is sort of this fine line between, if enough people tell you that what you're feeling is not what you're feeling, that can also be pretty depressing and isolating.
Yes.
And I think that's did you feel like one was pushing you to the other in a sense? Or you always had this conviction that you're not depressed, this is a real thing? And,
Right. I always had the conviction, but what was very helpful is, I think it was right after I got the diagnosis, I started seeing a therapist who sees a lot of lupus patients and autoimmune patients. And, that was just incredible, because I really got the support, but also from somebody who had so much knowledge. So it wasn't just, my doctor and some medication I was put on, but that I had this other support. And from that point on, anybody in my life that I told I had lupus, of course, there was never a question, just
right. Once you had the actual diagnosis, it's like getting it's like getting the blue check at Twitter, you're verified, right?
I know.
Yeah. But I assume now, having these years have passed, that relationship with your family, since it wasn't ever a cut off kind of situation, are they now part of your support system?
Well, they are in general, but I can't say that anybody really makes a big deal about the lupus. Now, there is one or two people who will say, like, I don't think you should try. This was right before the pandemic. Would say to me, I don't think you should travel because it's with your lupus, it's not safe. But the majority of my family really don't even talk about it or ask about it. And, I don't want to go into psychological reasons, but they just don't, and I don't talk about it. I mean, and thank God, it's not, my symptoms aren't severe right now.
Do you feel then that there still is some lingering isolation with the disease?
Yes. And what's surprising to me, maybe because I always look into things, research things, try to find out as much as I can in general about different issues. It's surprising to me that people don't, especially with somebody like me, who, let's say, was very close, didn't want to find out more. I don't think they know that much about it. And that's surprising, just because of where I come from, as far as, wanting to learn as much about different issues, especially if someone I loved, was suffering with it.
Right. Well, and look, I think being here and talking to me and doing this podcast, that's really a part of it. I mean, I think that's part of your journey, but I really believe that it can help lots of other people on their journey. So before we wrap up, just give me sort of your best advice for people who may be struggling with their family around their diagnosis or lack thereof diagnosis.
I would say, even though it's very difficult, try not to take it too personally if you're struggling with family, and just be persistent and trust yourself. Read as much as you can, keep going, try to find the best doctors in the field, and get support in the way of counseling, support groups, individual counseling. It's invaluable, but don't give up. And if you can, don't take it too personally. I know that's hard, but it helps.
I think that's great advice. And we're going to end it on that note. And I really appreciate you joining us, Andrea. I'm so thankful that you got the right diagnosis, got the right treatment, and really persisted, because I think the alternative is certainly no fun. So thanks for joining us, Andrea. Appreciate it.
It's a pleasure. Thanks for having me, Adam.
On behalf of the entire team at Lupus LA, we thank you for joining the Your Story, Our Fight podcast. Please tune in, spread the word, and come back for more inspiring lupus stories. I'm your host, Adam Selkowitz, wishing you good health, and to always remember, your story is our fight.